Hey guys, so today I wanted to talk about cholestasis. It was something that I was diagnosed with about 2 or 3 weeks ago. And yeah, just describing what it is, what causes it, and what my symptoms were, things like that, and then how I'm being treated now and how they're monitoring the baby now. So cholestasis is basically a liver disorder, and statistically actually only occurs in 1 in 1,000 pregnancies. It is more common in pregnancies where you're carrying multiples, or if you've already had a liver disorder or condition, or if you've already had a previous pregnancy where you did have cholestasis as well. But cholestasis can cause complications with your newborn. The worst, obviously, is stillborn babies and things like that. So it's just something that once you do feel a symptom, being very vocal with your doctor, because I didn't know like what it could have been. But since I did speak up to my doctor and talked about what I was going through, immediately they caught it. And once the test results came back from my blood tests, a couple days later, I was in the hospital for 3 days. Like, it was something that happened so quick. I woke up in the morning before I got the phone call of the test results, and I had no idea. I didn't feel like completely terrible, but the symptoms I did have, and the fact that I was vocal about something that seemed small or something like that, really helped the doctors figure out what was going on with me and the baby sooner, and I'm really grateful for that. So with cholestasis, basically bile in general. So bile is excreted from the liver and it's stored in the gallbladder, and that's what helps your body break down fat that you consume, turn it into fatty acids, which then your duodenum, like your intestines, can absorb. So basically cholestasis is a disorder where that normal flow is disrupted. So unfortunately, there's a buildup of bile acid in your liver and then also in your bloodstream, which then can cause really severe itching and things like that. Extra bile acid that is flowing into your bloodstream could cross the placenta and ultimately harm your baby. So it's something very important. I had no idea this was even a risk of pregnancy. There are so many symptoms of different things and new things that you're learning about your body, like during the whole process. So I was just really shocked, but very happy that I got medication and things like that. And yeah, some causes of cholestasis could have gallstones, you could have gestational diabetes, and that's what led up to cholestasis. It could just be a mixture of, like for me, it's a mixture of maybe a genetic mutation where somebody in my family, which nobody that I've spoken to has gotten it, but somebody way down the line had cholestasis in their pregnancy, kind of mixed with the extra estrogen that you have in your body as well. But there are a lot of different causes, and it's kind of hard to tell, but it's something that you just get during pregnancy, and then it goes away once you do give labor to the baby or give birth to the baby. But yeah, so this was kind of my story. These were my symptoms and how I found out. Basically, I was 32 weeks. Well, I started feeling the symptoms like 31 weeks, but I didn't know because the symptoms were something so similar to a normal pregnancy symptom. Like my boobs and my belly was itching really bad. And I thought it was just because I was starting to get a lot bigger. I thought it was just normal because my milk could be coming in. So I really didn't know. And then once 32 weeks hit, it wasn't just my boobs anymore and my belly, like the main problem areas where you're stretching and things like that. It was like my hands, my feet. I could not fall asleep because once I laid down, my feet and hands would be so itchy and uncomfortable, and I would just cry every night. But I just thought it was a normal, like, because I was swelling, or like I found so many reasons for it to be just, you know, no big deal, because I had no idea there was something with this symptom that could be something that could be fatal to my baby. You know, I had no idea. So at around like 32 weeks and a day or a day or two, I can't totally remember, I had an appointment, and that's when I spoke to the doctor about it. I was like, I don't know if I'm being like a baby about this, but I'm really itchy everywhere. Immediately I got a non-stress test and then also blood work done. The baby passed the non-stress test, like, which is basically her heart rate and her contractions. Like, everything was perfectly normal. She moves all the time. I know how she moves and I know how it feels when she moves, so I feel like I would catch it if she was moving any differently than normal. But yeah, so all that happened, and then it takes a few days, like a day or two, to get your results back from the blood work. And I got a call. I missed the call. I got a message. I listened to the message, and it was my doctor telling me your liver enzymes were like really high. Basically, they were in the 400 and 500s, where I should have been between 20 and 60. And my bile acids were through the roof. And I got the message, so I just called her back. I'm like, okay, should I go to emergency room? Should I go to labor and delivery? Like, where should I go? She was like, go to labor and delivery because we could have to induce you, things like that. And I was like, whoa, like I'm 32 weeks. I was really scared. We ended up staying 2 nights at the hospital, 3 days, just to get further testing. I got a lot of ultrasounds in like my GI, like in my kidneys and my gallbladder, things like that. And the whole time the baby was perfectly fine. Like she was passing all her tests with flying colors, but me, I wasn't. So now basically what's happening is I take medicine, and this was what would happen to you if you had it, most likely. Just taking medicine to regulate the bile acid and combat what's going on, and then be induced early. So right now I'm very closely monitored. I go to the doctor twice a week. Right now I'm 35 weeks anyways, so I probably would have been at this point. Since I am closely monitored, they do blood work every week. They do non-stress tests every week. If those bile acids ever go any higher, even with the medicine that I'm taking, they said they will induce sooner. But as of right now, I'm being induced between 36 and 37 weeks. But yeah, so if you do have cholestasis, I feel like the biggest thing is listen to your doctor more than any other video on YouTube, you know, because I was listening to videos and other people's stories and getting really scared because they just kept talking about like stillborn babies and things like that, and it was freaking me out. So if your doctor says like you're doing fine, just listen to them, take the medicine, do the treatment plan that they have in place for you, because everybody's body is different, and it's just important not to stress out, freak yourself out, or psych yourself out. It's not worth it. Chill out, because there's a ton of other stuff we're also worrying about at the same time. So thanks so much for watching this video. I hope you learned a lot, and good luck with your pregnancy. And yeah, like and subscribe, and I'll talk to you soon.